Hi, everyone, and thanks. Welcome to this digital health panel. My name is Stuart Henderson. I'm joined by three superstars in digital health. I'll introduce them in a second. I'm going to start off with introducing Krishna Cheriath. Krishna is a friend and colleague, someone I've had the chance to work with over the years. He is the head of digital and data analytics at Zoetis, one of the world's leading animal health companies. We got to know each other when he was the chief data officer at Bristol Myers Squibb, one of the world's leading oncology companies. And I describe him, and I think it's an understatement, he's an evangelist of digital and data. Delighted to have you here, Krishna. He's also, in his spare time, and I don't know where he finds his spare time, an adjunct faculty at Carnegie Mellon. We're also joined by Neil Gomez. Neil's the Senior Vice President of Digital and Human Experience at Common Spirit. It's the largest non-profit health system in the US, and his mission is to unify human and digital experiences. And then last, but certainly not least, my colleague at Accenture, Kaveh Savavi. Kaveh is a senior managing director in our health business. He and I get to work together every day as the intersection of life sciences, where I look after, and health, which he looks after. He's also, and I feel like I'm letting myself down, he's also an adjunct faculty member at Northwestern, the Kellogg School of Management. And so welcome to all of you. Thanks for agreeing to join me today at this panel. The conversation today is all about the advance in digital technology. If we look back 12 months, it couldn't be a year of more contradictions in terms of the terrible pandemic, where we've seen people dying at a rate that on a daily basis exceed that of 9/11. We've seen extraordinary tensions in the US, and we're just coming to the end of a significant political tension. But on the flip side, we've also seen just an amazing story. And that amazing story, of course, has been in health, in terms of the speed at which we've developed and discovered vaccines. Tech has played a massive role in that. And digital tech, as we see to start to roll out these vaccines and get people engaged, we're seeing the treatment paradigms where people had to see their doctors remotely and differently really roll itself into 2021. And consumers are showing a real willingness to play a more active role in managing their healthcare, but the technologies that are transforming clinical practice and opening up new ways to diagnose and expand those options, that they are also barriers to consumer adoptions, because digital health remains and includes concerns about privacy and trust. And that's what we're going to focus today. That's why I've got this panel of C-suite visionaries and practitioners with me today. I'm going to start with you, Krishna, on the basis that, I've worked with you, and I know one of the things you've talked heavily about in your past is don't see trust and transparency as a problem to be dealt with. See it as an opportunity to competitively differentiate yourself. Maybe you could kind of expand on that and give me some further insight just on how you think about how you use trust and transparency in a digital world to differentiate yourself.
Stuart, great to be here. Thank you for this opportunity, and hope the audience is safe and healthy during these interesting times. But as you stated in the open, Stuart, digital trust is eroding fast in our society. Fake news, data breaches, fear of misuse of data, lack of trust in algorithms, technology, and general fear of big tech companies is pervasive across society. And I think these trends are true in varying degrees in digital health as well. But as you said, I don't think of this as a challenge and a problem, but I think this is a very unique opportunity for innovators in the digital health space. And I think there is an opportunity to flip the script and think of this not as a challenge, but as a true competitive differentiator and compete on trust and transparency. So what does that mean? I think when you think about competing on trust and transparency as a digital health company, you're thinking about digital trust and transparency by design. So not as a minimum check the box exercise to uphold privacy or legal regulations, but truly looking at trust and transparency by design. Building on secure technologies and access controls from the get-go, and prioritizing trust and transparency in how you design your customer experience and engagement. So the way I think about this is trust as a new disruptor. And companies think of this as a true innovation priority. And those companies that prioritize and think of themselves that way, I think will be the winners in the days to come. Because innovation is true. Medicines of the future is going to be a combination of molecular therapy and digital medicines in varying degree. Digital innovation accelerated by COVID is a reality, and it's no more a nice to have, but a must have feature, and whether it's telehealth, or any other aspect of it. If you look at some of the vaccines that are coming through, the fact that they're able to do that in a year's time versus 5 years or 7 years of development, in significant part is through digital data and analytics. So in thinking about this as an innovation imperative, then what I encourage the digital health companies to consider is trust as a competitive differentiator. Think of it as an equally important innovation priority, and then compete on it, and you will be the winners.
That's great, Krishna. I'm definitely gonna. I've definitely written down trust as a disruptor. I think that is quite different angle to take on it. Kaveh, I'd like to kind of bring you in. I know you've done a lot of research on this, consumer research as well. Can get your perspective. What does the data and the research tell us about the way Krishna just framed that, which is we have a problem and trust is eroding.
Right. Yeah, thanks, Stuart. It's good to be here. And absolutely, we've been tracking consumer adoption of digital health technology since 2014, and that includes apps and wearables and virtual health. And what we saw is the period of 2018 to 2020 was a stalling in adoption. We hadn't crossed over the 50% mark. And when we looked at why, the single most common reason for citizens not adopting digital health tools is that they don't trust either the privacy or the security associated with their own healthcare data. 38% gave that answer. Now, there are other answers, but no answer was more common. A third of the people said that they don't believe that the data is going to be used appropriately by any of the parties. So it's not just, is it going to be stolen, but they're actually concerned that the data is going to be taken and then misused in some fashion. And what's really interesting is that trust has been eroded across all actors. So when we look at the hierarchy, typically the providers are trusted a little bit more than the tech companies, but erosion of trust occurred across all categories. And by 2020, pre-COVID, almost 1 out of 5 people said they didn't trust their provider, and half, actually 55%, didn't trust tech companies with their healthcare data.
Kaveh, that's some pretty stark numbers there. Maybe it's a good kind of opportunity to bring Neil in here, because whilst there was some worrying signs on trust there, the good news is that the providers are still the most trusted. And Neil, you as a provider hold that trusted position. How do you see the issue of digital trust? How can you provide that trust and transparency to get more? And kind of maybe just frame for me, as you think about your role, as you try to unify that human digital experience, how do you see both this digital trust as both a threat, but also more importantly, the opportunity? And I'd like you to focus not just on the point where you have those moments where you connect with the people who come to see you, the patients that come to see you, the interstitial moments where they're not seeing you as well as a place, not just in the because I think providers have that opportunity when they see the doctor, they grow in trust, but it's the moments in between that really are the places where trust is eroded as the threat space. Neil, I'd love to get your perspective.
Yeah, thank you very much, Stuart, and thank you for having me here. And I hope everyone watching this is staying safe and healthy. These are indeed concerning times, and we have seen, as Kaveh said, we've seen some erosion of trust, even on the provider side. So it's paramount, I think, to maintain that trust relationship. And if we are doing things with trust, as we were just talking about here, using it almost in a competitive kind of way, as Krishna was saying, we have to be very closely aware of that we have a great responsibility with the data that's being shared with us. It's very, very private data. Most people would not want it to go to anyone unless they they consented to that, and so we have to recognize that. I really like what you said about the time in between, Stuart. I think that's really awesome, and plays it well into a point I was trying to make, is that I think what we have to do, and what a great responsibility that we have, because consumers sometimes don't realize this, and I say the word consumers because I think it's important to this conversation. Not just patients, but truly consumers, because once we start talking about data and data as property, you start getting into the consumer kind of connotation too. And And I think that's the way we need to look at it, as this is a valuable property that the patient brings to us, right? And many times our patients as consumers do not realize that. And I think we have to enable consumers to use their data to improve their lives, with their consent, of course, but enable them to do that. So create those channels. Even if you wanted to compete on that, you would have to create those channels into that for that person, because it's in that manner. I don't think the patients are coming to us and saying, hey, I'd like to use my data in XYZ kind of way, right? We have to take that initiative and do that. So I think that's a great responsibility. I also think that, when you think of patients as consumers, data as property, you start getting into a choice. And you mentioned transparency. I mean, you're not a true consumer if you don't have choice, right? So we have to promote transparency also from our end, not just from the patient's end. And I think there's many ways to do that. Price transparency is one, which is something that many consumers and patients want with services in healthcare. Even service transparency, so physician transparency, information about our clinicians and informing people about how we're performing is extremely important too. So I think the data thing goes both ways. It's to establish a trust relationship. I am giving you a part of me, which is my personal data, and I expect something back from you too. And I think that enables you to kind of take care of the times in between. Looking at the health data as property that the person brings to you also enables you to engage with a patient in between so they can better manage their health. And then there are some new things coming out that are making this relationship extremely viable, even for really, really personal data like genomic data, right? And that's some of these synthetic data, transformations that you can do with existing data, so that you're not using direct patient identifiable data, but you're still able to use the data almost as if it were real, because it was synthesized to be that way. So I think that's going to enable a lot more research, a lot more. It's going to fuel some improvements in the way that we customize and personalize a patient's experience.
That's very interesting. I like the point you make there, data as property. And I think if you consider a patient or a consumer or a person today, they getting access to their own health data and owning it and having some responsibility for it is still a pretty alien concept for many of us, but something clearly you see as a provider on the horizon. Your point on synthetic data, I know, the time I spend in pharmaceutical industry is a massive investment in putting capability behind using synthetic data to reduce the amount of unnecessary research and focus on building what are the right research. Just think of oncology right now. If we took all of the combinations of different medicines we could put together against the different tumor types that we're looking at, we would probably, there's not enough humans in the world to really test all those options out. So we have to use synthetic data to narrow down those options. So thanks, Neil. I like that point, especially around the interstitial moments. Christian, I want to pivot a little bit to start to think about the tech companies over here. They have a very big role to play. And, we've talked about trust as a disruptor. I'm reminded of a phrase I was taught early on in my career by someone who is a great mentor to me. He used a Dutch phrase, which was, trust arrives on foot, but leaves by horse. I didn't try to say it in Dutch, as my Dutch is weak, but trust arrives on foot, but leaves by horse. I hope you get that concept. What advice would you have to the tech companies here today around how they manage the issues of trust and privacy as they enter and expand in the world of digital health? Because there's a ton of failures. I mean, digital health, it's a great, exciting opportunity, but we tend to focus on the extraordinary achievements. There's hundreds and hundreds of companies that haven't worked out. There's a lot of problems there, and I think trust and transparency lies at the bottom of many of those failures. What advice do you have for tech companies?
Stuart, I love the Dutch quote, and I'll follow with you offline to get the details on, and I'll copyright the usage. But I think to the point around what the 10 companies can do. The first and foremost is, as I said in the open, think of trust and transparency not just as a minimum check the box exercise, but truly a differentiated customer experience. So just take a simple example, informed consent. And all of us are guilty of clicking I agree to anything that is put in front of us before reading the terms and conditions. Not because we don't want to, because it's freaking difficult to go through reams of legalese to do it. What if you're able to innovate and make that easier and think of it from a consumer customer perspective so that they truly understand what they're consenting to? So really make that experience of trust and transparency friction-free and fluid and easy to do. An example that comes to my mind is in the early days of GDPR, a physician in Germany reached out to us saying that, what data do you have about me? We responded with the completeness and accuracy and timeliness. And the interesting thing was what the physician's response was, saying that because you agreed completely and I'm satisfied with your answer, I'm agreeing to these two other things that you're asking me to consent to. So, the being viewed as a trusted and transparent company can yield to differentiated customer engagement and deeper customer relationships. So that's the first one. Second is think about trust and transparency from the standpoint of an ecosystem and partnership. As a digital health company or a tech company, quite often your success is predicated on having the right ecosystem and collaborations and the ability to plug and play into existing workflows and ecosystems. Yes, innovation is needed. Viability of technology is all true aspects. I would also argue that if you're viewed as a trusted operator and a trusted stakeholder, your ability to plug and play into ecosystems and partnerships will be that much more greater. And you'll be able to broaden the depth of your data, make data a competitive differentiation by having better ecosystems and partnerships. The final thought I'll leave the tech companies with is, I love the phrase radical transparency, which is coined by Ray Dalio, the author of Principles and the CEO of Bridgewater Associates. So my encouragement to the digital health companies and other innovators in the digital health space is to think of radical trust and transparency. And when you are taking intentional, explicit actions at the customer engagement points in the design of your technology, in the design of our ecosystems and partnerships, you will see material difference in your ability to increase adoption, ability to plug and play in the ecosystems, and then be successful in the long run.
Thanks, Krishna. That's I like the reference to Ray Dalio there. Just from a provider perspective, Neil, you maintain personal. You've got this vision of uniting digital and patient experience, and how do you bring that trust and transparency to all those experiences? How do you bring that, to use that Ray Dalio quote that Krishna gave, that radical transparency to patients as to around what you're doing? I love the concept of, by being transparent with somebody, that you build trust, and as a result, that they agree to share more with you. How have you seen that work within the context of providers and your interactions between you as a healthcare provider and patients? When have you had experience like just Krishna talked about, where you're, by demonstrating you can be trusted, that patients give you more?
Yeah. Yeah, absolutely. I think that's happened with many studies in the genomic space, where you've seen as long as you're being very forthright with what you're doing with that data, you're revealing the relationships without the whole legalese and that long contract that most people just hit accept, and they feel violated even if they do that, right? If you present something as complex as such kind of things in front of a person, and then you expect them to read it, they still feel violated if they agree to it and they really haven't had a chance to read it all. So you don't want that, that's for sure. I think if you want to really create this relationship, this trust relationship, you've got to bring some tremendous value to the table when using private health data. So you can't just use it for trivial things, and you certainly cannot use it to market, additional services that are unnecessary. That's something that you should never do. And to get some kind of value for yourself that is malicious in any way. But the ways in which you can positively use data, I feel, and do what Krishna was saying, make it even a competitive advantage if you felt that way. I think it's more important to enable consumers to use their data to improve their lives. And the three ways I feel we can do that is, one is to engage the consumer first. We as consumers in healthcare are not truly as engaged with our own health, unfortunately, as we are with other things. Maybe buying, we're extremely engaged. We do the research, we try to find information, before we even buy something on one of the online retail sites, right? Or in person. In healthcare, we don't do that as much. So we have got to, as providers, engage the consumer, give them enough information, and personalize that information as much as possible. Second, so first is engage the consumer. Second is deliver health, not just healthcare. Healthcare is important, absolutely. But I think we've got to take it upon ourselves to deliver health. That develops a better trust relationship with the patient. It tells the patient, I'm not just concerned about you when you walk into my doors, but I'm concerned about you continuously, so that you stay healthy, not just, you come into my space when I need you and I can give you a bill. So that should not be that cannot create a trust relationship. And finally, which brings me back to the statement that I made, that you made about me, which is I'm on a mission to unify human and digital experiences. I think we need to use this relationship and use this data and create this trust so that we can be more human, in the way that we do things. So use digital data, all of these technologies and information to become more human, which seems kind of weird, but I think is absolutely essential. I think a lot of the great technologies that we try to apply to healthcare do not sometimes stick because it's focused too much on the technology and not about this relationship between the human and the technology that needs to be promoted more, especially in healthcare. I'd written a paper some time ago about ATMs and how they got into our lives, right? And initially it was really, really weird for people to even understand that relationship. Like, I always went to a teller, and Barclays put these up in the UK years and years ago, and it took a long time for people to really feel like that they would actually take out money from the ATM and then go into the bank to see if it had really changed their the amount of money in their accounts. So it was really odd, and I think that's what we're seeing in healthcare a little bit. That distrust of just the technologies sometimes, and as you said, sometimes the technology companies. And so I think we need to invest more time in bringing people together with the technologies and not just think that, they just accepted them. That's the way it is.
Thanks, Neil. I love. By the way, I'd love to learn more about that ATM story. I read a story recently about the ATM inventor, and I think about his partners. The fact that she still doesn't use an ATM, still goes in to see the teller. But Neil, thanks for that. I'm going to say a quick reminder, because we're doing well on time, and we have some questions coming in the chat. If you have questions, please feel free to put your questions in the chat, and we'll try to answer them. I'm going to ask one more question to you, Kaveh, before we go to Q&A. And Kaveh, really, we talked about Krishna's advice for tech companies. What about the healthcare industry? What advice would you have for them in terms of how they step up in terms of trust and transparency? Building on Neil's point, I think Neil's got demonstrated really from a provider perspective. But if you were sitting down with some of your provider clients today, what advice would you give them?
Well, I think that Krishna and Neil said it very well. I think we have to include the fact that the concept of a relationship evolves over time. It's not static. You don't give up. You don't get trust once. You continuously earn it. And even in the delivery system, people choose to expose parts of their information to some providers and not others. And this idea that people have that level of desire for self-control means we do have to embody a level of self-control and the ability for people to take pieces of information out on demand in order to continuously maintain that level of trust. The other point I would make is that the trusted position of the provider is something that I think that the technology industries and others should capitalize on. Going to the ecosystem comments that Krishna and Neil made, which is that it may be that from a right to win perspective, the tech companies may never be in as good a position as the delivery system, and the best opportunity is for the two of them to collaborate in some fashion, take advantage of the provider's trusted position. For example, we found that in our study that if a doctor recommends somebody to go use an app, it has almost no effect on their use of an app or a tool. But if the doctor actually uses it as part of the way they work, then adoption goes way up. So it's not so much that it simply exists, it actually has to be part of the way healthcare is practiced. And that becomes then naturally part of the way consumers would want to use these digital technologies.
Thanks, Krishna. That's a really good wrap. I'm going to pick up some of the questions that are coming in first. I'm going to direct the first one to you, Neil, because it's very much around electronic health records. And so as we see an expanded adoption of EHR tools so that medical information data sharing is controlled by the moving from being controlled by providers to being controlled by patients. What about that expanded adoption? Tell me more. What do you see that? And you're the one that's invested in creating those EHR platforms. Do you see a role where you're going to give patients control and access to their EHRs that allow them to control the access and do more? Tell us about what you're seeing there.
Yeah, absolutely. I think I mentioned that in the beginning. It's a great question because it's a question of the time that we're in right now, where a lot of the rules are changing around EMRs and the way that we share the data which resides in the EMRs with people and make it easy. And we certainly want to do that as providers. We want to enable that, and in digital we're doing as much as we can to create that channel. And I think to answer the question about what could we do and what would it enable, I think it's not just about getting the data to you, but getting the data to you in a very meaningful way. Just as physicians don't just want reams of data coming out, maybe out of a wearable or something like that, that they cannot really analyze for all of their patients all at once, right? We want insights. So I think to the tech companies here, as well as to us providers, because many of us are evolving into tech companies, it's important that we deliver those types of insights to the patient, not just give them their data, but simplify things. Maybe create indices. If let's say like some companies have done, creating a real age kind of index. So here's what your age is, but here's what your real age is based on the way you take care of yourself, right? And where your data is going. So I think, and that kind of stuff motivates people to say, okay, well, I can really quantify who I am right now and what I could be, and gives you a kind of goal to work towards. And I think that's the kind of stuff that we need to start doing with this data, rather than just, okay, here's all your data, now you go do what you want with it.
That's brilliant, Neil. I've got one more question, but it's actually for all three of you, and I'm going to give it to you because it's actually a great question from the web. So thanks for those who are watching. Is in one sentence, and it's the shortest sentence you could possibly give. What's your top piece of advice if you were to sit down with the CEO of whatever company who's thinking about being in digital health? They want your best piece of advice. What would it be? And because I'm tough, and because I think Kaveh will forgive me to give Krishna and Neil time to think. Kaveh, you're first. What's your one sentence top piece of advice on a company thinking to be about, I want to be in digital health and I'm concerned about trust and transparency? What is it?
Yeah. Possible does not mean permissible, and you have to focus on permissible in order to get the technology to be used.
Love it. Possible. That's a great one. Neil, what about you?
I'll go back to my previous statement. Enable us to be more human. Use your capabilities to enable us to personalize our interactions, even in between, as you said earlier.
Perfect. Krishna, last but definitely not least, I know the evangelist, you always have something magical for us to listen to. What is your one sentence?
Embrace it. It is a competitive opportunity. Think of this as an absolutely important innovation priority.
That's brilliant. Listen, I've really enjoyed my time with the three of you. I've been furiously writing here as we go. Trust as a disruptor, is one that's going to live with me. I've really enjoyed the opportunity. Thank you for imparting your wisdom. My final words are, thanks everyone for attending. Please be sure to visit Accenture Showcase. It's in the CES exhibitor directory. Click through to our virtual floor microsite. It's a 3D immersive experience that's been put together by Accenture. And you can explore all the research, much of the research that Kaveh talked about, and insights on three timely transformation topics, which are 5G, the enabling power of now, also industry, the business and change, the business of change and experience. You know, we've gone to always on change now, and then agile beyond expectations. You'll see how technology and human ingenuity are coming together to turn the challenge into change. Thank you again, all of you. It's been a fantastic session. Stay positive and test negative.